Okay guys, let's talk about something a lot of people experience but almost nobody gets warned about. Why a common heart medication can make you feel absolutely exhausted. I'm talking about Atenolol. If you've ever started this medication and thought, why do I feel like my energy got unplugged? This video is for you because there's a real physiological reason behind it. And no, it's not just getting older or being lazy. Let's get straight into this, guys. All I ask from you is just to hit the like button down below. It tells YouTube this is worth showing to more people. So if you like learning about health from a scientific perspective in a calm and collected way, consider subscribing too. First, let's start off with what is Atenolol, which, by the way, over 9.2 million prescriptions for Atenolol were filled in 2023, which goes to show a lot of people are taking this one but might not know exactly what it is. Atenolol is a beta blocker, meaning it blocks beta-1 adrenergic receptors in the heart and is used for high blood pressure, feeling anxious, chest pain, preventing migraines, and certain irregular heartbeats. These receptors normally respond to adrenaline and noradrenaline, the chemicals that tell your heart to beat faster and stronger. By blocking them, Atenolol lowers heart rate, reduces blood pressure, and decreases the workload on your heart. From a cardiovascular standpoint, that's a good thing. But from an energy standpoint, that's where the problem starts. Here's what most people don't realize. Your energy levels are tightly linked to your sympathetic nervous system, your go mode. Atenolol doesn't just calm your heart, it dampens your entire adrenaline signaling pathway. That means less heart rate response, less cardiac output during activity, and less oxygen delivered to your muscles and brain when you need it the most. So for example, when you try to exercise, climb stairs, or even just power through the day, your body can't ramp up the way it used to, and that shows up as, you guessed it, fatigue. Now here's an important nuance. Atenolol is more hydrophilic, meaning it doesn't cross the blood-brain barrier as easily as drugs like metoprolol or propranolol. So unlike those medications, Atenolol is less likely to cause vivid dreams or nightmares, but don't let that fool you. Even without heavily entering the brain, it still affects central fatigue indirectly by reducing blood flow dynamics, things like your exercise tolerance too, which is a common complaint. There's also an effect on exercise capacity too that people often notice before anything else. Studies show beta blockers like Atenolol can reduce VO2 max, which is your body's ability to use oxygen efficiently. In other words, your workouts feel harder, you gas out faster, and recovery takes just a little longer. And when your body feels chronically underpowered, your brain interrupts that as more fatigue and other side effects can come on board, like nausea, dizziness, concentration dips, and confusion. Another piece people don't talk about enough is blood sugar awareness. Atenolol can mask symptoms of low blood sugar, especially the classic warning sign, a racing heart. So if your blood sugar drops, your body doesn't give you the usual adrenaline-based alerts. That can leave you feeling shaky, weak, foggy, or drained without understanding why, which adds another layer to the fatigue. So okay guys, what should you do if Atenolol is making you tired? First, don't stop it abruptly. It's a box warning on Atenolol not to stop it cold turkey. Suddenly stopping a beta blocker can cause rebound hypertension, rapid heart rate, or even chest pain. Always talk to your doctor first before thinking about stopping. That's the main thing. Second, timing matters. Some people feel less fatigued when they take that Atenolol at night, while others do better in the morning. This depends on how sensitive you are to the drop in heart rate during the day. Third, the dosing matters a lot. Fatigue is dose dependent. A small reduction under medical supervision can dramatically improve energy without losing any of that cardiovascular protection. Fourth, med choice matters. Not all beta blockers affect energy the same way. Some people do better on beta blockers with partial agonist activity or on medications from entirely different blood pressure classes like ARBs or calcium channel blockers, depending on why the Atenolol was prescribed in the first place. And finally, support your physiology, guys. Stay hydrated, avoid skipping meals, ease into exercise instead of pushing through exhaustion, and pay attention to sleep quality because when your nervous system is being chemically slowed down, recovery becomes even more important. So here's the takeaway, guys. Atenolol doesn't make you tired because you're weak. It makes you tired because it blunts adrenaline signaling, lowers the cardiac output during activity, reduces the oxygen delivery, and limits your body's ability to respond to stress. That's the trade-off that I want you to take away. For most people, the heart protection is worth it. For others, the fatigue is a sign the medication or dose needs adjusting. If this explains something you've been dealing with, guys, do me a favor, hit that like button. It helps the channel get reached out to more people who can benefit from videos like this. And if you're on Atenolol and notice fatigue, drop a comment. You're definitely not alone. Take care of your heart, guys. Listen to your energy levels, and I'll see you guys on the next one.